Good afternoon, and welcome to the second episode of the Capitol Hill series, Why You Should Advocate. I am Bradley Coffey, the Manager of Government Affairs here at AAOE, and I am joined today by Mr. Joel James, who is the Director of Public and Government Affairs at Signature Medical Group and also happens to be the Chair of the AAOE Advocacy Council. Thank you for joining us today, Joel.
Sure, Brad.
So we want to get into talking about why people should be an advocate. So Joel, I'm going to kick it over to you and let you tell everyone why they should advocate for their practice, for AAOE, and just advocate in general.
Well, of course, I think we're all too well aware how much healthcare is changing. Even with the change in administrations, we can see the regulatory environment is not appreciably changed in terms of getting less onerous, though the CMS has said they're trying to do that with their patients over paperwork initiative. But the fact of the matter is that healthcare is continuing to be in transition, in various ways. Providers deciding to go to hospitals, providers falling out of hospitals, trying to find a physician group, physician burnout at a relatively high rate. So there's all those aspects, and then there's the whole environment of the transition toward more value-based care, Medicare looking for ways to reduce their cost exposure to the trust fund. So it continues and will continue to be in flux, for a long time. And certainly along with this, the costs of care have not really appreciably declined either. As a matter of fact, they continue to increase, though increasing at maybe a slower rate than they had in a couple of decades previously, but it's still, we're already at a very high level. So when something costs $4,000 and increased 15%, 15 years ago, that's one cost. But if the same thing's costing $20,000 this year and is increasing at 5%, it's extra. It's just a much more higher impact on patients and on the Medicare Trust Fund. And certainly, reimbursement rates have not been going through the roof. Medicare's been looking for other ways to be creative about how they pay physicians. Using MIPS and advanced alternative payment models as a way to entice their involvement in quality and cost. So there's just the environmental issues, and on the one side. The other side is the fact that we need to be advocating. We need to be advocating for our patients, for what's right for our practices and for orthopedics. And that's why we have a democracy. We can go to Washington and talk to people and not be afraid of being jailed, or otherwise being taken away and, never seen again, as can happen in other countries when you are trying to change policy or change the system. So, and then we also have competitors in this space, obviously, some of which are not all that friendly to orthopedic medicine necessarily, some that try to stop us from being able to offer, in-office ancillary services, and so forth. So the fact of the matter is there's just a lot of other organizations that are competing in this space, so we need to have a voice. And we need to have it on a regular basis.
Great, thanks. And yeah, I just want to jump in and add, Politico released their lobbying reports for the second quarter of 2018. And just talking about competitors, I mean, a lot of the top lobbying groups of organizations, not lobbyists, but organizations that are up there lobbying are healthcare organizations. And I think one of the ones at the very top of that list was the American Hospital Association. I believe they reported spending about $4.5 million just in the second quarter alone. So, I mean, that's that's huge. And hospitals and orthopedic independent medicine don't always line up as being allies on every issue. Certainly, there are some where we can work together, but I think it's absolutely imperative that people be on Capitol Hill advocating for their own practices, advocating for their association. So I want to transition into talking about who should be an advocate and who can best advocate for their practice. And the very first thing that I would say is you. You are your own best advocate. AAOE provides you with information on policy, available alternatives, but ultimately your legislators want to hear from you. You can vote for them. AAOE cannot. The constituent is probably one of the most powerful people on Capitol Hill because you and the people within your network and within your locality determine whether or not that person comes back in 2 years. Even CMS, which is full of unelected bureaucrats, want to hear from you because you are the ones implementing the requirements of the law that they are in charge of enforcing, but you end up having to implement in your practice. You have experience on the ground with these policies, something the legislators and the bureaucrats don't have. While AAOE can provide legislators and executive agencies with a broad picture of trends and issues that we've identified through surveys of membership and other means of data collection, there are a few things that we can't do that is crucial to holding policymakers accountable on policy. And now I've already discussed one of those. Like I said, AAOE cannot vote for legislators. So therefore, it's important that constituents be there actively advocating for the issues they care about. Secondly, AAOE cannot lobby for an individual practice. You, however, can. You can lobby for your own practice. We can provide you with the tools and training you need to be an effective advocate for your practice and profession. But ultimately, that advocacy for your practice, your physicians, your staff, the patients you serve, all of that has to be done by you. I will also say that in addition to yourself, others in your life can advocate for your practice. Again, your physicians, your staff, and patients are all affected by the policies that CMS and Congress create. And to effectively advocate for the practice's needs, all of these constituencies need to be engaged. They don't have to attend AAOE's Capitol Hill Day, however, they are welcome to attend, but they should be registered on AAOE's Legislative Action Center to take part in virtual fly-ins and action alerts. You can access the Legislative Action Center via the AAOE website, simply AAOE.net, and the link will be on the homepage there. Additionally, your family and friends can advocate for you. While they're not directly impacted by many of these policies, they see the policies' effects on you and your work and can be helpful in spreading your message across a much broader swath of a legislator's constituency. Joel, is there anything you wanted to add to that?
No, I just think it is important to remember that it's just not always about us individually as members of AOE. It's a rather large healthcare world, and so as Brad pointed out, there are a lot of folks that are affected directly or indirectly by healthcare policy, and just about everyone in some way is exposed to something in the healthcare system. And more times than not, it's sometimes not the best experience someone's had. So being able to use those stories and those experiences of others can be very important in our work and our advocacy.
Great. So now let's talk a little bit about what should you advocate for. So we'll kind of tag team on this one, Joel. I just want to talk a little bit about AOE's policy agenda, and then Joel, I'll let you talk about defining that agenda, the practices agenda, and then we'll talk about some of the issues that we'll be advocating for at Capitol Hill Day. So AAOE's policy agenda is available to you at aaoe.net/positions. On this page, you can also find out how AAOE's position statements are created and even submit a suggestion for the Advocacy Council and eventually the Board of Directors to consider. Now, these statements are official announcements on how AAOE thinks about certain issues. So they're very important to the advocacy work that we do, and they're very important to actually establishing AAOE as a vital resource for these policymakers. So Joel, I'll turn it over to you now.
So, yeah, it's understandable, even though we have a particular agenda for policy issues at AOE, it might not be the most critical thing that you or your physicians are really feeling strongly about. So, maybe we like to say it's also, these issues are important, but you can also create your own adventure, right? I mean, what's the issue that has you guys and gals really charged up, that is, maybe affecting your practice on a day-to-day basis that isn't specifically on the AOE agenda. So, it's what you advocate for, how you spend the time in those meetings is really up to you. We're giving you kind of a guidepost of issues that are very broad for orthopedic practice. It's the ones that the Advocacy Council has reviewed and debated, and also run by the board of directors. So we know they are relevant to a very broad population within AOE, within the membership. But don't let that dissuade you from thinking you have to stick to a specific script.
Great. So now I just want to talk a little bit about some of the positions that AOE will be advocating for on Capitol Hill Day. So our first is innovation in total joint care. Many of you may know that CMS actually removed total knee arthroplasty from the inpatient-only list in 2017. What they didn't do was add it to the ambulatory surgery center's covered procedure list. So this advocacy position statement is actually advocating for adding that procedure, as well as upper joint replacements and hip replacements, to the ambulatory surgery center covered procedure list. And this addition would allow those procedures to be performed on patients that are eligible for it in ambulatory surgery centers. The second issue that we're looking at is value-based payment model design. So this is a really timely issue, as we're finding out, is that with CMS and the Centers for Medicare and Medicaid Innovation have created BPCI Advanced, they didn't really engage stakeholders in the creation of this program. And we're seeing that a lot with a lot of these value-based payment models that are coming out of the agency. So what we're advocating for is including stakeholders in this design, because there are issues that are preventing surgeons and other physicians from actually signing up for these payment models, which is ultimately hindering CMS's goal of moving from the fee-for-service over to the value-based payment programs. The third issue that we're looking at is equalizing the payment of bone density testing and using the densitometry scanners in physician offices. Right now, due to congressional statute, those payments have been cut to about half of what is provided in an inpatient facility, or I believe even in a hospital outpatient facility. So we're trying to equalize that and increase some of the competition for that, and allow for yet another ancillary service that a practice could provide. And the fourth issue is one that's carried over from last year and continues to be a concern to us because it does limit competition. And this is turning into yet another timely issue as the House Ways and Means Committee held a hearing on reforming the Stark Law, and Congressman Sam Johnson brought this issue up, but it is to repeal the ban on physician-owned hospitals. We really believe that this is an issue of competition, and that competition can actually reduce the cost of care for surgical episodes and just other clinical episodes of care. Is there anything else you'd like to add to those, Joel?
No, Brad, I think you covered that pretty well.
Great. So I will kick it back over to you to also talk about when you should advocate.
You should advocate every day. That's all I have to say. No. So, yes, there's no set calendar. There may be times that are the most opportune to be, for instance, on the Hill, getting into your legislator's office and talking about something. But that doesn't happen very often. It's like, maybe right before a vote on a really critical piece of legislation. And but usually our advocacy is I don't want to say it's not like evolutionary, but it's an ongoing thing. It's not. We try not to make this a one-time event. Capitol Hill Day is certainly annually, but there's many things we're doing throughout the year. And advocacy isn't always just about talking to your legislator or their staff. It's communicating with CMS on issues. So, Capitol Hill Day is obviously a great time because then you have your fellow members with you at AOE. There is a set strategy. There's lots of support for what you want to do on the Hill. Then there's also district work periods at home when legislators, especially on the House side, they're back in the district, every month, several times a month. Most members try to go back for the weekend, though they're not always working the weekend, but many times they are. But usually during those district work periods during the week, they leave room in their schedules for doing meetings in the district, for meeting with constituents. And even outside the district work period, you can always, stop by your legislator's, district office, meet their staff, get to know them. What are they hearing from constituents on healthcare issues, and show that you can be a resource to them locally too. They really appreciate that. Following the release of a proposed rule is another option, and that's really to do with Medicare and Medicaid. If there's a rule that's been proposed that is going to have an impact on orthopedics, on medicine, independent practices, hospital, whatever your interest is, that's an opportunity to weigh in on that proposed rule and submit comments. And our government makes it actually really pretty easy to get involved in a process like that. You go online, and it gives you a format to write your response. They can be long, they can be short, anywhere in between. And you hit the submit button, and then you can later go back and see your comment, and then you can see comments of all the other responders that have commented on the rule and see where you line up. So that's obviously an opportune time. When there's an action alert that's distributed by AOE, meaning something is going on that we would like members to contact their representatives or senators regarding, that's a great time to take a minute and see what has been sent out in the action alert. And often, we draft a suggested statement that can be emailed into your member's office. Again, the software we use for this, the link you get, it's very easy to do. Many of you have done this, I'm sure, but you open it up, you put in your location, it gives you your House member and or your senator, depending on if you're contacting both offices. And then it has a suggested and editable note that you can send along with the position that we might be taking with regard to that issue, whether it's a legislative initiative or a bill about to be voted on or whatever it may be. And then really, as I said at the outset, really any time. I mean, advocacy is an ongoing issue. These issues don't stop. Time doesn't freeze in healthcare. And there's always something that's being developed that we need to keep an eye on that can be very beneficial for us, or maybe not. And but the point is to be able to be responsive in both cases.
Great. So let's move on to discussing how health policy affects the average AAOE member. So, I'll talk a little bit about this. If you were on last month's webinar, some of this may feel a little repetitive to you. Healthcare is one of the most regulated industries in the United States. Everything that you do in your practice is touched by regulation and/or legislation, whether it's healthcare policy, employment policy, just about anything, financial policy, even trade policy affects you in some way. So the government can impact your negotiations with insurers through the McCarran-Ferguson Act, which allows insurers to essentially collude and share information that does not permit the same activity for practices. But your practice's compensation structures are also influenced through the application of the Stark Law. The use of certified electronic health records technology in your practice was also a health policy that went through Congress, and even the expenditures that your practice makes. So what you're spending money on in your practice. All of these touch points serve to make life either easier or more difficult for you, and it is precisely these touch points that makes your advocacy and influence necessary. Again, you all are the experts on how these particular policies affect you. You know how the CERT requirement for the MIPS program affects your practice, how it affects the bottom line of your practice. So it's important that you advocate on that. So now let's talk a little bit about how to actually affect policy. Like we've been talking about, advocacy in person is fantastic, but there are other ways. So Joel, I'll let you talk a little bit about this.
Obviously the ways you can do it, the most obvious is you vote, right? So you don't like what a member is doing or another elected official, you certainly have the opportunity to at least voice your displeasure at the ballot box. So needless to say, voting remains a key aspect that actually more Americans should be taking advantage of in elections than they do right now. So joining an interest group, while you're in one now with AOE, there are others that you can be getting involved in and help you stay aware of what the issues are and what may be of interest to you. And then writing your members of Congress, we talked about having a, responding with an issues alert from AOE, but you can certainly do that on your own anytime. Writing a member of Congress is easy. Again, it's as easy as writing an email. You can also consider hosting, your congressional rep, your local congressional rep at your practice. Have them come in. For instance, we want to help legislators understand the role of ASCs. That they don't know that can be a location for a lot of surgery that now is being done in the hospital. And as Brad mentioned earlier, we're going to be advocating for, some more episodes besides total knees to be done outside the inpatient setting. Our goal is to go beyond that and ensure that such policies allow them to be done in an ASC, not just in a hospital outpatient department. So if you have ASCs in your practice, you might consider having your local rep come in and look at one and understand how they're run, how they're managed, how safe they are, the kind of success rate you have, the kind of surgeries you do there. And that would be very useful to keep them, when they see that bill come across that, is allowing something like this, they have a good understanding of what that would mean. And then, of course, visiting the Capitol, on Capitol Hill Day or other times, and meeting with your legislators in Washington. And it's really good to be up there at a time when, I've always tried to practice having relationships and starting them when there's no crisis, because it's not the best time to walk in, and the first time you meet your rep or staff is sometimes it has to be during a crisis, but ideally you've already had a relationship and you've been there to help them with information, or just to have courtesy meetings, just to get to know the person. And then when the crisis does occur, they're not seeing you for the very first time, and I think that can often just sends a different kind of signal. That you've been there before, you wanted to have this relationship, you're on friendly terms, and now there's something really important that come up that you need their attention on.
Yeah, and Joel, I think that's a great point, and something we hadn't addressed earlier is that everything that we're talking about, meeting with your legislators, all of that, this is really about building a relationship in order to use that relationship for the benefit of your practice in the future. So while, you might not be successful in getting the Stark Law overturned the first time you go into an office, it's all about building that relationship so that eventually they view you as a trusted partner and come to you for information on how the Stark Law affects your practice when an eventual Stark Law repeal or reform bill is introduced. So let's talk a little bit about visiting Capitol Hill. We'll talk a little bit about this more in depth as it relates to Capitol Hill Day in the next webinar, but we've made it easy for you to meet with your legislators in Washington, D.C. AAOE's Capitol Hill Day is a safe and effective way to influence policy. Staff, meaning myself, schedules appointments for you. We provide talking points. The issues are selected by the Advocacy Council for you to use, and we provide training. Joel and I actually got some feedback last year that our training was hilarious, so you even get an opportunity to laugh a little bit while you're learning something. So this is really your chance to bring our message to the people who can make a difference in your life. If you're not engaged, someone else will be, and the resulting policy could be detrimental to you and your practice. So let's talk a little bit about the Capitol Hill environment. You hear a lot about stuff going on up there, and we want to dispel a couple of myths and rumors. So Joel, you're up there quite a bit, so I'll let you talk about this.
Yeah, so, all of us that don't immediately reside inside the beltway of Washington, meaning just about, every one of us, we hear in the media and so far how crazy it really is. And the environment it's kind of wacky, right? But I've been doing this work quite a while, and the environment's always been somewhat wacky. Maybe it's a little wackier than normal these days, but the point of the matter is please don't be dissuaded from coming to Capitol Hill Day out of fear that there are just too many crazy people running around with their hair on fire. It's really not like that. I see Brad's put some photos up here. The frequent photos, actually, if I have my location right, that is a hallway in the Hart Building, Hart Senate Building. And you can see to the right there, fantastic sculpture by Alexander Calder, and sitting in the middle of the lobby of the Hart Building, and you can look down there and see, it's all pretty empty. And then that's the frequent look of most Senate and House office buildings. You see a few people walking around. The infrequent one is when, and that's also the Hart Building, that's lobby, that's the same Calder sculpture, and it had upwards of 300 or 400 women protesting, the family separation policies of that were enforced in this administration recently. And but even there, it was a lot of women gathered around to protest. There were no guns going off. People weren't being dragged out bodily. I know some folks were arrested, but I don't think they were even taken to jail. I mean, I've never, all the years I've been in DC, I've never seen things ever get out of hand. And that's a very kind of a rare occurrence anyway. Usually the most disruptive things that happen usually happen in a hearing room during a hearing when someone's testifying on something some group doesn't like, and they run in there and start yelling things and then run out again. So it's the environment is actually, the staff are very nice. They're appreciative of people spending their time to come and talk to them, and many from their home states, and and there's other things to talk about like sports or what you did on your vacation, and I mean it's a business environment like a lot of business environments. It's just a little different. But please don't be fearful of coming to Washington out of some of the crazy things you hear, because it's just not. It's really not like that on a regular basis.
Yeah, and I would just add to that, I go up there at least once a month, and when I'm up on Capitol Hill, that's probably the safest I've ever felt anywhere, because they do have security protocols in place, and people, they may protest, but they are, once they're in the buildings, they are very respectful of the environment in which they're in. They might be loud, but they're not rioting or anything like that. They are respectful demonstrators generally.
Yeah, the only thing you really need to be fearful of is if it's hot or rainy or snowy and you're going into one of the House or Senate office buildings and you see a group of about 150 high school kids on their school tour getting in front of you in the security line. That is a problem.
Yes, I ran into that in June when I was up there.
Yeah, that's usually the biggest problem I ever run into, but I also know to go to another building and go into one that's not so crowded. So, and then take the tunnels over. So, that's usually where I get worried. Or trying to find a cab when it starts raining, that can be a real problem. But fortunately, we'll be staying right at the Hyatt Regency, or the Hyatt, Capitol Hill Hyatt, right, right on the Senate side of Capitol Hill, very close to all the buildings, so you won't even have to worry about a cab.
Yes, so I hope that this helps comfort some people who are concerned about the environment on Capitol Hill. If you have any additional questions, please feel free to email me or call me. My information is displayed on the screen. Or if you would like to register, visit aaoe.net/hillday. Again, any questions, please don't hesitate to contact me. Joel, I want to thank you very much again for taking the time to be on this webinar with me. And we hope to see you in Washington, D.C. soon.
Thanks, Brad.